We're live, Kathy.
Okay, thank you. So good morning. Thank you for joining us on this Friday, December 13th, 2024. I'm Kathy Turner, Director of Communications at the Louisville Metro Department of Public Health and Wellness. We're here today to talk about a concerning increase in chickenpox cases in Louisville. Joining us to explain is Dr. Chris Bryant, our Associate Medical Director and Pediatric Infectious Disease Specialist at Norton Children's. Also joining us is Dr. Patricia Bautista Severa, the current chair of the Louisville Metro Board of Health and the Health Empowerment Coordinator for La Casita Center here in Louisville. I'd like to ask everyone to mute your devices. When we turn to questions, please raise your hand so I can call on you, or you can just put your question in the chat. For members of our Spanish media, feel free to ask your questions in Spanish. Dr. Bautista will facilitate translation. So let's start off with Dr. Bryant. Dr. Bryant, can you give us a situation update?
Yes, Kathy, thank you. So in recent weeks, we have seen a spike in cases of chickenpox in Jefferson County. We have also seen a handful of cases in surrounding counties. Now, chickenpox in recent years has been an uncommon disease. We might see a case a month, a case every other month. In November and December, we've seen a definite increase in cases. These cases have occurred in both children and adults who are unvaccinated. Now, let's talk for just a minute about chickenpox. Chickenpox is a highly contagious viral illness. The symptoms include fever and an itchy rash. The rash often starts out as red bumps on the torso and on the scalp. These red bumps turn into fluid-filled blisters that ultimately break open and scab, and they can spread to the entire body. Infected people can have as many as 500 spots. The good news is that we have safe and effective vaccines to prevent chickenpox. These vaccines are given at 12 to 15 months for the first dose, and then the second dose is given between 4 to 6 years of age. If we have older people, teenagers, adults who've never had chickenpox and don't have immunity, they can also get vaccine.
Great, thank you, Dr. Bryant. I think there might be a perception that chickenpox is a harmless childhood disease. Could you address that? Certainly there must be some individuals that are much more at high risk than others. Should they get chickenpox?
Chickenpox is a mild disease in many children. Before we had the availability of chickenpox vaccines, nearly everybody in the US got chickenpox by the time they were 9 or 10 years of age. But there are certainly people who are at risk for more severe disease. This includes young children, children under a year of age, teenagers, and adults are at risk to get more severe chickenpox. And people who have weak immune systems may get very severe chickenpox. Now, complications of chickenpox can occur in people of any age. One of the most common complications is a secondary bacterial infection. Once those blisters on the skin break open, bacteria can get in and cause an infection of the skin or soft tissue that sometimes spreads to other parts of the body. Chickenpox can also result in pneumonia. Very rarely, it can cause inflammation of the brain or bleeding problems. Even for people who have mild disease, though, even when it's not severe, it can be miserable. Imagine an itchy rash all over the body that lasts for up to a week. You can't go to daycare or school or work while you're contagious, and you're contagious until all of those spots scab over.
Thank you. And I believe at least one of our cases was in a pregnant person. Are there any particular or special precautions information we should share for pregnant people?
Chickenpox can be more severe in pregnant people, and it can have pretty severe consequences for the developing fetus. And so the best advice is for people who are considering pregnancy to find out if they're immune, and if they're not immune, to get vaccination before pregnancy. If a person is pregnant and they are not immune to chickenpox, then they want to take measures to protect themselves if they can. One challenge is that people with chickenpox are contagious for 1 to 2 days before they develop a rash. So that makes it tricky. I think some people also don't know that chickenpox isn't just spread by people with chickenpox. It can also be spread by touching the rash of a person with shingles. And so the best advice really is for people to know whether or not they are immune to chickenpox, and if not, talk to their healthcare provider about vaccination. The vaccine cannot be given during pregnancy. It has to be given before or after pregnancy.
Thank you. So for parents who are watching or listening, what guidance can you give them if their child has chickenpox?
So the best advice for parents is first find out if your child is immune to chickenpox. Have they had their recommended chickenpox vaccines? If not, make an appointment with your pediatrician or primary care provider. If your child develops a fever and a blistering rash, call your pediatrician or primary care provider to ask, could this be chickenpox? It's best to call ahead to let your pediatrician know that you're worried about chickenpox. We don't want people with chickenpox to sit in a waiting room because the virus can spread through the air. And so if chickenpox is a possibility, your pediatrician will give you special instructions about how to come to the office without exposing other people. There is a medication that can be used to treat chickenpox. If you're worried, if your child does have chickenpox, you can ask your pediatrician or primary care provider if this medication is right for your child and could it be beneficial.
Okay, so if we wanted to offer top 3 takeaways for today, one certainly is that chickenpox is highly contagious and we are seeing a concerning increase. What would be 2 other takeaways you want people to have?
For healthcare providers in the community, think about chickenpox when people come in with fever and a rash that looks like little blisters. Chickenpox has been so uncommon in our community in recent years, really in recent decades, that there are many healthcare providers in our community who've never seen a case of chickenpox. And that's a testament to our immunization program. So consider this when in your differential diagnosis, in your list of diagnoses that you're considering when patients present with fever and a rash. For others in the community, know if you and your child are protected against chickenpox. If you are a parent, ask your child's pediatrician or primary care provider, is my child up to date with their chickenpox vaccines? For any adult, know if you're immune to chickenpox. Have you had the vaccine or did you have chickenpox growing up? That's what happened to me. I was born before chickenpox vaccine was available. I think we also need to remember that we have friends and neighbors in the community who grew up outside the US in countries that don't offer chickenpox vaccine. If this is your situation, know that chickenpox vaccines are available. They can be given to adults. Talk to your doctor or primary care provider about whether or not you need chickenpox vaccine to protect yourself.
Thank you so much. I don't see any hands raised or questions in the chat. To our media friends, does anyone want to ask a question? And while you're thinking about that, Dr. Batista Severa, is there anything else you would like to add in English? And then I will, in just a minute, ask you to, if you'd like, to offer a summary of this important information in Spanish for our Spanish-speaking audience.
No comments on my side. Thank you, Dr. Bryan.
Okay, well, I do not see any questions in the chat. No one has their hand raised. So, Dr. Batista Severo, would you like to offer a summary of this important information for our Spanish-speaking audience?
Por supuesto. Muchas gracias. Muy buenos días a todos. Entonces, estamos aquí para comentar que recientemente se han observado un número mayor de casos de varicela, tanto en el condado de Jefferson como en condados aledaños. En octubre, noviembre y ahora en diciembre se han reportado casos confirmados de varicela. Y esto es importante porque la varicela es una enfermedad muy contagiosa que inicia con fiebre, mal estado general y después tiene una erupción cutánea que inicia con manchitas rojas que pueden estar elevadas y que rápidamente se transforman a vesículas o ampollas y que puede ser contagioso aún antes de que empiece con fiebre. 1 o 2 días antes de que empiece con fiebre puede ya estar contagiándose y como lo señalaba la doctora Bryan, el, el contagio es no únicamente al tocar el líquido que sale de las vesículas, sino también puede contagiarse a través del aire. Es decir, mediante hablar, toser o estornudar, una persona puede contagiar a otra, por lo que necesitamos estar pendientes de si alguna de nuestras personas en nuestra familia o en nuestra comunidad ha tenido fiebre y tiene esta erupción con vesículas, es importante sospechar varicela. Si usted es un adulto y no ha tenido la enfermedad y no sabe si está vacunado, es importante que se vacune. La vacuna está recomendada para los niños a partir de los 12 meses de edad. La primera dosis de 12 a 15 meses y la segunda dosis es entre los 4 y los 6 años de edad. Hay personas dentro de la comunidad que tienen un mayor riesgo de enfermedad, al enfermarse, un mayor riesgo de tener enfermedad complicada, que puede ser no solo el que se agregue infección bacteriana cuando se rascan, en las lesiones que se rascan, sino que también puede haber complicaciones a nivel de inflamación en el sistema nervioso central o puede también haber neumonía. Es muy incómoda, esta enfermedad es muy incómoda, puede causar muchísima comezón, por lo tanto es importante baño diario y cortado de uñas, etcétera. En el caso de mujeres embarazadas, es importante que sepamos si ya tienen inmunidad previa o si ya fueron vacunadas para que si usted está pensando embarazarse, asegúrese de que tiene niveles de inmunidad y si no los tiene, vacúnese antes del embarazo. Si usted se embaraza y se infecta con varicela, su bebé puede tener daño durante la formación. Y si adquiere varicela durante o alrededor del parto, su bebé puede tener muchos problemas. La varicela también se puede contagiar a través de pacientes que tienen herpes zóster o shingles o culebrilla. Entonces, es importante que como papás averigüen si ustedes están inmunizados y si no están inmunizados, se vacunen lo mismo con sus niños, si ya tienen niveles de inmunidad y si no, hablen con los pediatras para que se vacunen. Si su bebé o su hijito tiene fiebre y empieza con algún rash, que empiezan a aparecer vesículas o ampollas, llame a su pediatra y avise para que lo revisen. En caso necesario, hay medicamento disponible, tienen que hablar con sus médicos y recuerde, lo más importante es averiguar si usted tiene inmunidad y si no vacunarse. Listo.
Thank you so much. Did you also see the question that was in the chat from one of our Facebook people who are listening, I don't want to, that is from a Spanish media outlet. So I wanted to give you a chance to answer the question. Maybe you want
I
to say,
haven't.
okay,
It says that if you have received the vaccine
yes.
as kid, do you need to receive it again? No. No, if you received your 2 doses, just if you have any doubts, I think the best advice would be to 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 make sure that you have the immunity levels, the antibodies in your body. So I'm going to answer this in Spanish.
Okay.
Si usted ya recibió las vacunas, son 2 dosis de vacunas las que se necesitan, pero si todavía tiene duda, no necesita recibir nueva vacuna, o si ya tuvo la enfermedad, no necesita vacunarse. Pero si tiene duda, ante la duda, vaya con su médico para que mida los niveles de anticuerpos contra varicela para estar seguros de que usted está protegido.
Thank you so much. Dr. Bryant, anything else to add? If not, we can close.
No, I completely agree with Dr. Batista Severa about if you've had chickenpox vaccine as a child, you don't need it again. But remember, shingles vaccine is recommended for adults 50 and older. So I would recommend all adults 50 and older to make sure that you are up to date on your shingles vaccines.
Okay.
I have
I,
another question.
oh, you do have another question? Okay, thank you.
Yes. There's another question from Alia, and they're asking if they're planning on traveling this season, should they take any precautions?
Do they
Dr.
mean with
O'Brien?
regard to chickenpox or just traveling in general to be as healthy as possible?
I believe like if they're traveling abroad and they just need to be cautious of where they're going, in case there could be an outbreak. Yes.
Okay.
I think it is always a good idea before you travel domestically or before you travel outside the country to make sure that you are up to date on all recommended vaccinations, including chickenpox vaccinations, but also things like flu and COVID. Those viruses are circulating right now. When you travel, you can't always predict what you're going to come into contact with. You may be in a crowded place on an airplane. You can't move away from people who are coughing. And so, before you travel, make sure you're up to date on all recommended vaccinations. While you're traveling, wash your hands well. And if you're a person who is at risk to get more severe disease, from flu, from COVID, from chickenpox, from anything, if you have a weak immune system, you can consider wearing a mask. Anybody can consider wearing a mask if you're going to be in a crowded place and you can't step away from people who are sick or coughing.
Doctor,
So
I was going to
I'm going to
ask you if you
comment.
don't offer that in Spanish, offer those tips in
Yes.
Spanish.
Yes, so I will comment on 2 of the things that just mentioned Dr. Bryan. La doctora Bryan comentó que es muy importante que recordemos que varicela también puede ser adquirida de pacientes con herpes zóster o shingles o culebrilla. Entonces, también se recomienda la vacuna contra shingles o contra herpes zóster a partir de los 50 años de edad para todos los adultos. Es muy importante, independientemente de que hayan tenido o no varicela o se hayan puesto vacuna, la vacuna para 50 años o más es muy importante. En cuanto a las recomendaciones para viajar fuera del país, como siempre, es importante estar seguros que estamos con nuestras vacunas al día, pero de cualquier manera siempre ser precavidos, asegurarnos que nos lavamos las manos tan frecuente como podamos, y en caso de que tengamos algún compromiso a la inmunidad, siempre usar un cubrebocas, viajar con nuestro cubrebocas disponible. Recuerden, la mayor parte de las enfermedades infecciosas se pueden transmitir en el aire. Entonces, traiga su cubrebocas con usted, póngaselo sobre todo en lugares cerrados y sin ventilación. Estas son las recomendaciones más importantes. There is another question. What are the risks of shingles vaccines I have heard they might have complications in the nervous system. Dr. Bryan?
Yeah, the most common complications or side effects, not complications, the most common side effects of the shingles vaccine are pain at the injection site. That's true of any vaccine. Other pretty common symptoms include muscle aches, tiredness. You may have a headache. Some people get fever after shingles vaccine, and it's stimulating the immune system to fight against the virus. Some people may also get an upset stomach. Most of the time, the side effects from the shingles vaccine are mild, and they just last a couple of days.
La doctora Ryan nos comenta que no hay complicaciones con la vacuna contra shingles o herpes zóster. Como toda vacuna tiene efectos secundarios y algunos de estos efectos secundarios pueden ser más intensos para unos individuos que para otros. Como para todas las vacunas hay dolor en el sitio de aplicación, puede haber dolor muscular, incluso hasta fiebre o compromiso a nivel gastrointestinal, pero son efectos secundarios esperados y no se ha reportado ningún otro efecto. Son generalmente efectos leves a moderados que tienden a desaparecer en unos días.
I don't know if the questioner might have had questions about uncommon neurologic side effects like Guillain-Barré syndrome or other things like that. Those sorts of side effects are uncommon. Also realize that shingles itself can affect the nervous system. And so the safest thing to do is to protect yourself from shingles. But if people have questions about their own personal situation and what their risk might be, they should always talk to their doctor.
Excellent. Thank you, Dr. Bryant. Thank you, Dr. Batista Severa. Catalina, if there are no more questions from Spanish media or the Facebook side.
No, yeah, the person that asked the question about the shingles, he says, yes, Dr. Bryan, thank you for that answer.
Okay, great. Okay, great. Thank you. Well, thanks everyone for joining us today. Thank you to our doctors for providing their expertise. Without any further questions, we will end this media briefing. Thank you so much.
Thank you.
Thank you.